but actually there is a group of you here who are just fresh from surgery. Some of you who are probably about a month or so, and some of you who are 6 months, and there's a couple of longer term patients. And you all will have very different experiences. The first 6 weeks usually is hard, but it's somewhat expected because you've kind of gone through the education of it, you've gone through the classes, and you know what to expect. It's still fresh in your mind, so you're not so thrown off by certain challenges. It does get harder in a different way as you get further away from surgery. You kind of master the kind of simple day-to-day routines of what you should have, what you shouldn't have, what kind of things can get you into trouble, and what are the ideal ways of eating. As you get further away from surgery, those become second nature, typically. What does become a challenge are more emotional or social dimensions. You kind of 6 months out, a year out, back at work fully, socializing more, and you may have some short plateaus that you're all going to experience, and you will need to know that this is very normal during that first year or 18 months until you get to that 18 months, and that's the long plateau where you really would not lose much more weight, maybe a few pounds up or down. And your challenges then are different. It's not so much what I should eat, what I shouldn't eat, although if you plateaued earlier at a higher weight, you should always go back and reassess your intake, what you're doing right and what you're doing wrong. And in the class we were having ahead of you, we were talking about how calorie counting in your head is never as accurate as if you objectively know. And there are some applications, website applications like MyFitnessPal or Lose It, that if you haven't used, you should try out and make sure that you know accurately your intake. And if you are off and you are gaining weight and you are not losing the weight that you thought you should be, you go and analyze this for 2-3 days, take a look at it and see where you need to optimize yourself. If you're way below the calorific intake, you have to up it, and vice versa. If you have to trim it down, you trim it. And then, work environment, sometimes you may not have enough support from family, changes that come your way in life. So these are things that you have to, in life, handle. And so your coping mechanisms in the past may have been resort to eating. Now you kind of don't have that option. Or if you do try and exercise it again and again, the danger is you may put the weight back on. And if you don't have those options, what else is there? So we've talked about this in other support groups. There is cross-addiction. We have issues with alcohol. Some start to resort to that. Some start to resort to gambling. Some to shopping. Some actually turn to sexuality and all of those things. So, or sex and intimacy, and so there are crossovers in all of these areas, and it's important to recognize those and to have coping mechanisms. So, like the example Liz started to talk to you about it, she's going to elaborate a little bit, is that it will throw you off, and you won't really know, and you have to have a good support system. I have a number of patients who, like, in their office, 3 or 4 ended up having surgery, so they have their own local little, or some go to their prayer services at churches and temples that they know each other and they have support through there, or they have support through members of their family, or if you're a teacher, through other teachers, or come to meetings like this. But it is important to have that. It's an outlet. Sometimes you may come out of it learning something and feel that, okay, I should try this. Sometimes it's only been a session to vent a little bit, but it does make it important, and it does give you a sense of accountability. And if you don't have that, and you don't follow up, and you don't see your doctors, and you don't discuss things with your kids, and you don't talk over the issues with your spouse, and this kind of all bottles up, you are going to feel overwhelmed. And I had one patient of mine actually this last couple of weeks that the life had taken a lot of turns, and she was doing beautifully, but she was now faced with a lot of changes, and she's kind of totally gone off track, and she knows. And that's something that, okay, you recognize, and once that issue or insult passes, you got to get back on track. Sometimes you can, while all of this is happening, try and now concentrate on taking your vitamins twice a day, and da. So for little bouts, if you miss that, you're allowed. But you can't just miss it and let it go, because then you'll get into trouble. So whatever coping mechanism you're going to have to adapt, you've got to think about it and adapt it. You don't let it go for a year, for 6 months, because the disasters that we occasionally get referred or see, whether they're other physicians or, let's say, our own, thank God it's not really frequently, is a patient who, let's say, we called and said, look, your follow-up is up, they haven't done their labs, and then the second call goes through, they don't answer it, and then we send an email, and then we send a registered mail, and then we don't hear anything. A year goes by, 18 months goes by, and then we get a call. I'm struggling. I've lost faith in this, I'm not losing weight, or now I have an ulcer, or now I have B deficiency, I'm anemic, or, so these are things that you need to avoid, and the way to avoid it is to follow what you need to do, and if you have struggles that come your way, ask for help, and have people around you help you and kind of hold you up, and if you're going to want to do it on your own, don't drift away for long periods of time. As I said, short bursts you can, other times you just have to get back on track. And majority do really well, and you will find other ways. Other mechanisms. Some are exercise. I mean, some become very avid at it and very fanatical about it. And and it's a great thing. And Liz has personal experience. She'll talk to you about it. Some will develop interests, other things. I have a couple who picked up other habits, playing music or doing artwork. So you'll find your niche, but the key is find that. Okay?
What suits your soul? It's what suits
your soul. It's true. It does. It really comes down to that. And there's no tricks to it. You just got to find it for yourself. But be open to suggestions. Really be out of a box kind of a thinker. And you have to be very creative. Learn from others who've experienced things. Also know that you're different. Everyone is unique and they have their own ways. And so adapt it to suit you, but follow those guidelines as best as you can. As long as you stay true to those, as I said, most of the patients do very well long term. And if you don't succeed the way you wanted to, we had this discussion again a few weeks ago. It's not a failure, it's just a delayed success, and you got to keep at it. And if you don't lose that amount of weight that you had thought you will, instead of 100 pounds you lost 60, well, you've lost 60. That's a lot of weight, and a lot of your comorbidities will improve. They may not go all the way to where we wanted them, but you're definitely a lot better off. So your goals have to be objective. If you work hard at it, most of you will get very close to it. And for those who fall short of it, go back, reevaluate, make sure that you're doing all the steps correctly, stay with it, and get the support from people around you, and get help. It's not shameful to ask for help, okay? And you need to be comfortable with that and use the coping mechanisms, alternative ways, and other things that you feel will help you to get to your goal, okay? So as a group, I'm going to have you, please, share some of your difficulties, if you like, because I think people learn a lot more from difficulties than from your successes. Not that I want you to not talk about the successes, but the difficulties are better. And then the group, and I know a few of you are like within about 6 months to a year. How many of you are here 6 months to a year from surgery? Okay. And then the rest are over a year, right?
Okay. Are you talking about after surgery?
2 months. So,
yeah,
right. So the group that is within 6 to 8 weeks, right? I want you, please speak first, and it's not a formal. Just speak out, and then Liz is a good moderator, really, in that sense. And then the second group, which is within that period of, let's say, 2 months to a year, and then the rest of you, which is over a year, because I think you're going to learn a lot from each other here. For definitely those of you who are just coming off surgery, you learn a lot from the other, so your expectations of what to face in the next year will be handled nicely by people who have been there and done it. Also, the other thing is, I don't know if there's anyone here who hasn't had surgery, who's kind of thinking about it, right? Because there are always patients I tell, look, come to the support group. If you're not sure if you want to have the bypass or the sleeve, hear about it. Sometimes people say things that will either throw you off or completely click you on. So this is important. So please just express those again. With Liz acting as a moderator, she'll be able to hopefully intervene. Okay? So go for it.
Go. Let me hear. You just look at you. You look great.
Thank you.
You really look great. Just.
I've lost 32 pounds.
So what's been hard?
The protein drinks.
Why?
I'm gonna tell the truth. I'm not gonna lie.
No,
No, it's okay.
I know. Yeah, I'm looking at my doctor. Our doctor.
No, just feel comfortable.
Here, real quick. I'm one of those people that's considering this. So when you guys are talking to each other, you had. I was gonna ask the same thing.
I had the sleeve,
Okay.
and I think any surgery that I call him soft paws because he's got the softest hands in the world. Anything that Dr. Yadegar does, you'll know when it's right. I think the sleeve's perfect for me, and it really does work. It's hard when the first 2 weeks are really hard.
How come?
Because mentally I keep saying, oh, well, I know I can eat all this food. I know I can, even if he said I only can be on like soft foods, but you really can't. Once you have the surgery, I tried, okay, I'm going to tell the truth. I tried a piece of eggplant because I like Thai food. Well, they say the sleeve doesn't get the dumping syndrome. The sleeve does get the dumping syndrome.
Well,
And
you talked about it. So, so it was just feeling of getting stuck, which we talked earlier in the class.
Well, and then I had 1 scoop of rice, and I put a lot of soy sauce on it, and I went white, sweating, almost passed out, and yes, I did get it. So I'm not going to have that for like a long, long time. And eggplant is good, but like I didn't know. Well, I think they fried it too, and that probably made me sick. The protein drinks. Protein I know is the most important thing, like you said. I do drink them. I'm on my 3rd week, so I can eat albacore with fat-free milk whip, and I don't throw that up. But I only have 2 tablespoons of it, and then.
Does it feel like you've had like
It feels like I've had a whole pizza,
uh-huh.
and I could have done a whole pizza before. Not a whole one, but maybe 6 slices.
A whole small one?
Yeah, a whole small one.
So I have a question for you.
You want to know about the surgery?
No, the food that you can take. How often do you get sick after?
I've only been sick 1 time, and that's because of the eggplant, and it was really like the dumping syndrome. I turned
So
paler
you-
than
Other than that, if you follow.
you-
Oh, sorry.
Oh, I'm sorry, go
and I
ahead.
got a little bit of diarrhea too, and
So do you think that you got sick because you ate too soon?
yes, that's one thing, that I should not have had the eggplant on the 2nd week. You really have to follow what Dr. Yadegar tells
As
you.
long as you follow along,
Yeah.
you don't have a problem.
Yeah, it's all like the soft food, cottage cheese, and I can't do the yellow of the egg. I just do the egg white, and maybe I shouldn't put a pinch of salt on it,
That's
but I
okay.
put a tiny bit.
That's okay.
And the water is what I was frightened about, that I couldn't consume the water. I was terrified of it. I can do the water now, and it's the 3rd week, because I used to drink a lot of water, and then when you're in the hospital, you can't, but you will after. So you can stay hydrated, and the surgery is painful, but you get a little trigger thing, and they really do care about your pain, and the nurses are beautiful, and the doctors, Liz comes and says, "You lied," you say, "Yeah." And Liz comes in, but it's just so well. I forgot to tell Dr. Yadegar that I got to cut down already on my blood pressure pills.
Right.
I was taking 100 milligrams, now I'm down to 50 in 3 weeks.
What did you start to tell us about protein?
You just really you gotta put in your mind, I have to have protein. So the protein, you've gotta make yourself drink the protein and eat protein. So you've got to get it in.
You have
No,
to either
it's-
tolerate it or like it.
Yeah.
Thank you for that.
I'm 3 months out, and I've been struggling with, like, getting the protein in, getting the water in. I had the Roark, and sometimes it's really hard because it's the weirdest thing. Like, I can drink this with my protein. I drink I've now gotten the nectar unflavored, and these are the little packets that you get, like the strawberry, orange from, like, Crystal Light package.
Where do you get it
And I
from?
have 3 scoops into 16 ounces, and that's 30 grams. And I'm still struggling to even meet 60 grams of protein plus the water.
Where do you get it at?
The nectar, I order it offline from Vitacost. Vitacost is a website that sells, nectar. And I get the natural peach. It doesn't have that
Chalky.
flavor.
That aftertaste.
That aftertaste you get with fake, sweeteners. And then the unflavored one. I didn't like the durian flavored. I like this unflavored better. And so even though I constantly carry it with me now, I just switched from, instead of a big cup, I made it short and fat. This is 16 ounces, but I think I'm trying to psychologically, it's different than the big cup.
And I truly believe sometimes you have to play a psychological game in your head to get yourself to where you need to be. Because what I did with my protein, because I made that protein up and no one told me anything because I had no education. And I made that protein and I remember putting it on my counter and I drank a little bit of it. I was like, oh my gosh, I got to drink that. And I looked and it was separated. I was done. So I had to figure out a way for myself to make it work. And a lot of times we're kind of like our own science experiment, And I remember I took 4 ounces of Crystal Light and then I would put a scoop of protein powder in it. And I figured, 2 days out, I could get 4 ounces in a half hour or so. And so I just made it really concentrated. And that's how I got through it. And I mean, I was by day two home from the hospital, I was getting 100 grams of protein.
What surgery did you get?
I had a Roark 8 years ago.
And what is that?
The bypass.
Oh, okay.
And my thing is that I'm struggling with that, I'm struggling with the water, and my weight loss in the last several weeks has plateaued. Again, I had a weird plateau after about a month that lasted, that was kind of weird, that was like a week and a half or something.
That's not abnormal.
But you know what, I found that's more normal. When I plateaued at 4 weeks, I panicked. And when I went online, I found that more people plateau at like 4 to 5 weeks
Because I lost
than
the
any
water
other
weight,
time.
and an additional, after the 2 weeks, I had lost, the water weight, which was about 24 pounds, almost 20 to 24 pounds. And at 4 weeks, I had lost 35 pounds, so there was an additional 15 there. I had spent the 3 months lost 50 pounds, but I've noticed that it's slowing.
And the plateaus are normal because this is what has to happen is that you've lost all this weight. Whoosh, it's gone like that. And your body's like, whoa, what's happening here? And it has to stop and it has to kind of recalibrate and stabilize. And then it starts again.
So my question is, and the other thing that I found really weird is that I can pretty much eat anything now, and I've already actually started incorporating salads and stuff like that. Some of the hard things I can't. But I drink the protein and I get full, and it takes me a long time to get through that. Yet I'm still hungry, and I'm hungry for food. I'm hungry for eating, and I'm hungry for, and then...
You're hungry for what you don't have.
Yeah, and so I'm just... And when I do eat, sometimes I can eat more, sometimes I can eat less. I think I'm confused on what portion size I'm supposed to be eating.
Typically, soft foods, moister foods, liquidy foods you can have more of, for sure. So if you're finding that those are the kind of things that you have 6 to 8 ounces versus if you're having a piece of chicken breast,
4 ounces.
that you can only have 3 or 4 ounces, that's very normal. Okay, so the pouch typically will accommodate textured foods about 3 or 4 ounces. And you have to remember, the pouch and that part of the bowel that is just connected to it are one unit. Even though the pouch itself is 2 or 1.5 ounce, that adjoining part of the valve is another 1.5 ounces. So if it's liquid, it goes straight through, the pouch empties, you can have it again. So that's why we always say when you're eating a meal, that solid portion, the protein portion goes in first, because that's the most nutritious, is the one that fills you up fastest, and then the other things follow. So one of the reasons you're seeing that discrepancy is because of that. That's entirely normal. And your comment about the plateaus, I think, was addressed, but bear in mind that if you find that you are not making progress, always go and look at your intake. Make sure you are on track. And just do it for a couple of days. It's a typical day. And if you're off, then you know where to kind of fine-tune it.
Believe it or not, start a food diary.
Right.
Start the food diary and start looking. You may not even be getting enough calories in. And you need to get the calories in. So it would be beneficial to you. And I stress food diaries a lot. And you can go on to, MyFitnessPal.
I have one. I hate that. It's been my biggest struggle
I know.
from like the beginning of the
But you know what?
I didn't even do it in Weight Watchers. Like it was.
It's so boring.
It is boring,
Yeah,
but you
very
want to know
boring.
something, you guys. People who are successful, when they hit those bumps in the road, that's what they do. Is they pull out some paper and start journaling their food, and you kind of go, okay.
How much, for like 3 months, how much, because at the 3-week mark, it was, okay, try to get 60 grams of liquid protein, and the rest make up in food.
Right.
I don't think I'm getting enough protein in the food, so how much protein should I get in liquid, and how much does my body actually absorb of the solid protein?
Well, what you need is, you need 80 to 100 grams. That is what your goal is to shoot for. Low is 80, high is 100, as long as you don't have, any kidney issues or anything such as that, gout, anything like that. So your goal with your protein supplement along with your food is to get to 80 to 100.
How much did you get with the food? So if I eat a cup of cottage cheese, or half a cup of cottage cheese, 14 grams of protein, how much of that does my body absorb?
You probably will absorb most of it.
Most of it, yeah.
Up to servings, typically you'll absorb about 20, 25 grams. So if you notice, most of these protein shakes are scooped, about 25, 24. So you want to make sure that you have your 3 small meals, and typically they will give you about 20 grams each. So that's your 60 grams from your solids, and then the other 40 grams you take as your supplemental. So you take one shake, 20 or 25 grams between breakfast and lunch.
So is that what I'm supposed to get, the 3 meals a day?
3 small meals, that's the ideal.
Yes.
Now, if you're replacing one of your meals with your protein shake, and you're having 2 meals and 2 shakes, you got to make sure that you're getting enough. And that's why you want to make sure that you use one of these apps. See, number 1, am I 12 to 1400, and am I 80 to 100 of the protein?
Okay.
I wanted to tell the people that have this sleeve or going to have this sleeve. I was also worried about, because I am on medication, and beautiful over there said I can swallow anything that's like a dime. I forget the first one. Adrian. And so I still was terrified about the first time I was going to swallow. When you can swallow, and the first week when I took my blood pressure meds, when I was drinking the protein, they didn't work. On the second week, when I started with cottage cheese and then took my medicine, then it worked. Because I got what he said, it blocked the medicine in the stomach, and then I guess it was able to dissolve in my stomach. So sometimes pills won't work at first.
I don't know what surgery to get, but I smoke right now, and I'm quitting October 1st. I'm going to attempt to start that day.
You really got to
As
quit
far,
smoking.
I am planning on it. I even told everybody they're not allowed to even smoke on my property starting
Too
October
dangerous.
1st.
Too dangerous for you.
That too. But I use it for my stress. Does anybody after the surgery, what do you guys do for stress?
Exercise. I exercise.
That's it?
I exercise.
Really?
I I talk to people.
I try.
It's an outlet.
Other times I just try it out, it helps.
Some people actually get a journal, and they journal, and they write their feelings down, and they tell their feelings to that piece of paper, because that piece of paper is not going to judge them.
Various product lines, and some of you will like some of them, some of you will hate it, and then the roles reverse. A few months later, you change your palette.
And it changes. It does change, because I mean, I think during the education class, I was talking. I've been using Isopure now for almost 8 years, but there was a while where I switched to Nectar, and I hung out with Nectar for a while, and I went back to Isopure. Isopure seems to be the best one that works for me. I mix it. I do a lot of different mixing with it, and the issue with some of the proteins, if you take them and put them in a blender and whir them up, they get frothy.
Yeah.
And all you have is this foam. If you, like with me, we do the Isopure, and we do it with almond milk, and we put a little bit of unsweetened cocoa powder, and we sweeten it a little bit with some Splenda, and we whir it up in the blender. Someone was asking me about fruit in protein drinks, and I've addressed this issue before. If you're going to mix fruit with a protein drink, it could get you in trouble, especially if you've had a bypass. Because, first of all, how ripe is the fruit that you're throwing in there? So the sugars in the fruit can make you dumb. The other thing is that when you eat fruit, the benefit you're getting from the fruit is the fiber. As soon as you start taking that fiber and start breaking it down, you start losing some of the benefit of the fiber in the fruit. Because if you have fiber, you actually end up, it helps maintain your satiety and helps stave off some of your hunger. So, and then you have to be real careful. How much fruit are you throwing into something? Are you just willy-nilly throwing a banana, a couple handfuls of some berries with it, and then pretty soon your nice 130, 150 calorie protein drink is now 300-400 calories. I mean, and it's fruit, it's good for you, but like anything else, too much can be too much of a good thing.